But Don, can you hear me?
Yep, I can.
So I'm logging in from my phone, and I can't.
That's okay. I can share from here, right?
Yes, you should be able to.
Okay. I think I can. I'm having issues with my CDC computer. It won't connect to the internet. So I have my other computer that didn't have any, didn't have the Canva password saved or whatever. And it just took forever to try to change resize. But it's done. I did it. Hopefully it works.
Okay.
But I don't know what's wrong with this other computer.
Maybe it was our internet.
I don't know. Everyone else seems to be connected. But I'm getting kicked out of Zoom. I got kicked out of a Zoom call yesterday. I don't know. Something with the CDC's, I guess, privacy protection or security.
Oh, okay, yeah.
I don't know.
Sometimes if there's an upgrade, it does that.
That's what I'm reading. I'm finding the Microsoft upgraded, and I don't know what's happening.
Well, I'm not in the office. I know that there were some people that came off of isolation. Do you guys have the current numbers?
I upload it to the Excel document. I don't know.
I don't have access to it, so.
I could.
If not, I could go with it and see
if it changed.
Yeah.
Yep. Good. Yeah.
It did change. I think we have. We only have one case. We should only have one case. Maybe. I don't know. I don't know if they tested out or not, but might.
Okay. I updated it yesterday in the Excel document, and I'll change it again if it.
Okay.
I'll check it.
Well, either way, if they didn't test out, we're still at 3 cases. So let's just get started, because this is going to be pretty short. I'm going to say what I need to say, and then you all can take over from there.
Okay.
I was just trying to see if anybody was going to join, or if any of the rest of the team was going to jump on. If not, we can get started. Just wait until Darylyn comes back. So what did you think about the committee meeting last night?
It was good. It was like a chapter house meeting.
Yeah?
Yep, just like it. So yeah, familiar people come and they voice what they feel. Yes. So it was good. It was very informational. I was like, I needed this at the start of
Yeah. That's what this, I know people are going to be listening to this conversation later on if they rewatch this, but what this is kind of what this is designed to do, right? It's designed to create opportunities for community members to engage with the administration. And I am in a position where I welcome both positive and constructive feedback because I think
Mhm.
that's important. Because if people are telling you that you're doing everything correct all the time and you know that you're not because things just aren't the way that you would like them to be, that means there's no honesty there. And I prefer to have that openness from the community. So having a forum like that, it gives that opportunity, and I appreciated it.
Mhm.
And it gives
Yep.
you an opportunity to think about things because as people start asking you questions, like, "Oh, I didn't think about that," or um, "That's a good idea." So
So,
anyway, so what is today? Today is September 1st, 2022. It's 11:10 now.
Yeah.
Says 31131. And then what's the other one? New as
That
in.
one, the one. There's no new cases today, so that first one doesn't count.
Okay.
But that way I was gonna, but Thelma's not on yet. I was just gonna verify. Is that KK one? She was supposed to call this morning to verify if she.
So we'll just
came
leave her
out-
on.
Oh, okay.
Yeah.
'Cause I think she came out of
Okay.
isolation.
Okay. So we may have one that came out of isolation, but she didn't call this morning to verify with Thelma. Just FYI, Troy.
Say it again.
I said I
didn't hear you.
posted in the chat. I said I posted in the chat the activity as of yesterday, what we have on the board. Active cases
that's
3,
exactly what I
new
assumed.
today,
Yeah.
1, new in the last 7-day, 1, positive since 11/20, 304, recovered 299. So nothing changed. We're supposed to have one come out of isolation, but they haven't reported. They are testing out today, but they haven't called Thelma or anybody. So
Okay. Oh, that's good. Let's just go with that. I know that my understanding is nobody tested out. So for those folks who are listening, at those numbers that are we just mentioned are the numbers for the COVID cases. So we have 3 active cases as of today. We should have some coming out of isolation here soon if they test out. We've only had 1 case in the past week. 304 total cases, which is not much difference from last week's report, and with 299 having recovered. So it's a good report still because we have not had an explosion of cases, which is great. So with that being said, the thing that I wanted to talk about the most is the most recent FDA approval for the Omicron targeting booster shot, which was approved yesterday through the FDA, and I think they expect either by tomorrow or by Monday for the CDC to approve it. So it'll be prepared to be distributed to the masses. What I think is interesting, though, is that Pfizer presented theirs, and we thought that because Moderna presented theirs after Pfizer, there was going to be a delay in the approval. But the FDA made a decision to approve both at the exact same time. So when the booster is authorized by the CDC, both Moderna and Pfizer will be offering the Omicron-specific, Omicron targeting booster for everybody to take. So there's not going to be an issue or question about which booster you want to get because both of them will be available. So that was the good news. I did want to, because there's always questions about the monkeypox virus. The most recent update from the state of New Mexico, the Department of Health, There are stating that there have been 26 total cases of monkeypox in the state of New Mexico, which is a rise from the last report that we gave, because I think the last time we talked about it, there were 5 known monkeypox cases in New Mexico, and now there's just been 26. So that really is all I wanted to bring up. LaDon or the rest of the team, do you have anything else to bring up about COVID?
Just the information I have, maybe a little later, I'm not sure, with
Okay.
going cholesterol and COVID.
Okay. Well, I'm done with my update. If you all want to just take over from there, I'm gonna go ahead and step off, and you guys can take it from here. The regular report.
Okay.
So just give whatever department or program reports need to be given, and you should be good.
I'll go first. So, hello everyone. My name is LaDon Yazzie. I'm the Tribal Public Health Educator here in San Ildefonso. It looks like we have 3 individuals here, but some of the things that we've been working on, I've been working with Healthy Kids, Healthy Community Coordinator Victoria Martinez, and we've been trying to put together a few activities in the upcoming fall season. And so we're working with the Learning Center to create curriculum to provide the students with more hands-on activities. That's going to increase their, I guess it's targeting nutrition, but also we're targeting recreational activities, increasing physical activities. So that's what we're doing. And then we also met with the day school to see if we can work a few programs so we can meet deliverables down the road. And those also encompass a few physical activity, but also nutrition based or nutrition related topics. This month, we've put together an outdoor cooking event, and we've teamed up with Farm RX or Farm Prescription in New Mexico. And so this outdoor cooking event will take place in Santa Fe. We've distributed a flyer in the bulletin, and that has information that will provide the location. I'm sorry, I'm not familiar with Santa Fe, and I can't direct you and give you like historical spots on where this farm is. It's called Reunity Farms, and we will have transportation provided to those who need it. You will need to notify me and call the COVID hotline and leave me with details of how many individuals want to participate. This event is targeting all of San Ildefonso, so they will call it vulnerable groups, which are families with children. It's not particularly families with children, but individuals who are feeding children or feeding families. So what's going to take place is we'll leave at 3:45 here on September 14th and take over a van of individuals to participate in nutrition education and also the food demonstration and cooking. And then we'll also have produce provided by the National New Mexico Farmers Association. So they'll provide us with some produce. And then we also have another event we're trying to put together. It's for whole grains this month. For September, it's whole grains month. So we're going to try to put together a specialty bread making session with the community. Those details are yet to come. I'll let you know. And yeah, I think that's all I have for the updates from me.
Can you hear me? Yeah. Sorry, having issues with the computer. I'm kind of lost.
Can you let me in, Madame?
Oh. Oh. Sorry, guys. I am offering Tai Chi classes on Tuesdays and Thursday mornings at 11. We're also doing our Walking for Wellness on Tuesday and Thursday mornings at, I believe, still at 8:15. So come out and join us. Fitness assessments, call me, let me know when you would like to schedule an appointment. I think that's about it for me right now. Also gonna be working with the day school, having nutrition and health sessions with them on Fridays. Also getting together with the after school program and also doing nutrition and health sessions. I think that is it. I'm done.
Okay, so also today we also have we'll be providing produce. So the community supported agriculture, once again, is providing the community with 20 bags of produce. Previously, what we've been doing is taking the produce to individuals, meeting criteria, families. You can come to, I believe Thelma's going to be under the big tree distributing these produce bags. She starts at 12:30 and she stays there till about 2 or until all the produce bags are gone. That's an update from Thelma. Anything else? Anybody want to add anything? If not, I'll go into share, hopefully, my presentation. Yeah.
I'll mute since I know you.
Say that again.
Good morning, everyone. I was just gonna let you all know that they'll have a free COVID-19 vaccine that will be happening tomorrow. It's going to be at the McCurdy Charter School in Espanola. It's going to be held from 11 to 3 p.m. And they'll be offering for ages 12 and up the Pfizer and Moderna, for infants 6 months to 4-year-old Pfizer, and then kids age 5 to 11 Pfizer. Walk-ins are welcome. And so that will be happening tomorrow, the September 2nd from 11 to 3.
It won't let me. Oh. Hi, I was going to share. Oh. Troy, the ladies would like to log in. Claudia would like to be. Not sure. So I can't seem to share my screen. I had a presentation regarding cholesterol and how an individual who has abnormally high cholesterol can have more challenges or added challenges if they were if they got COVID-19. So it's a little bit difficult to try to work with some information that's not visible, but I'll just go ahead and talk about what I was going to share. So this month is National Cholesterol Awareness Month, and with COVID-19, this creates a challenge. So we're going through these ebbs, the ebb and flow of what's going on with COVID. So there are studies that link COVID-19 and cardiovascular, increase your risk of cardiovascular difficulties. So research finds how individuals with abnormally high or low density lipoproteins. So we talked about LDL cholesterol and how LDL is the bad cholesterol, so that comes from some of our saturated fats or some of our animal fats. And so high consumption of this type of fat is not good. And so that combined with high triglycerides can increase mortality rates in those who have COVID-19. So we want to be careful of all these different individuals we're coming into contact with. Individuals with a high BMI or high LDL are at increased risk of getting COVID-19. That sounds strange, but those are more susceptible. The underlying risk factors are unknown why this happens. And so what's taking place is that scientists are theorizing, or they're taking this educated guess, and they're suggesting that LDL promotes blood vessel abnormalities in individuals with COVID-19. The COVID-19 virus does this by invading the endothelial cells and causes injury. The injury triggers inflammation reaction, and it will lead to blood clotting. So really, COVID-19, being the virus that it is, will compromise what's going on in your body. It will compromise your arteries and kind of create this inflammatory reaction. And so I had an image of the veins and endothelial cells. Endothelial cells are really microscopic, microscopic lining within your veins, within your arteries. And so these endothelial cells in somebody who has high cholesterol will have atherosclerotic plaque, and this because of this, COVID-19 is more likely to attack those cells, and it will rupture the plaque. It will put the patient, a patient who has heart preconditions, at high risk of blood clotting. And as a result, having high cholesterol does more damage to a person's arteries. And so if your LDL cholesterol builds up in the bloodstream, the bad cholesterol, it narrows and it can clog your arteries. It also increases your risk of having heart attack, stroke, and it'll compromise your heart. So increasing your heart to work harder, longer, trying to push that blood through your arteries and your veins. So that stresses the heart. And so we've talked about this many times, preventative problems that we can prevent, or prevention, preventative ways that we can keep this from happening, from increasing our cholesterol, and also reducing our reducing how we contract the virus. So the preventative issues that we can, the different ways we can reduce this issue in those who have high cholesterol, is to take your medication. So also you want to make sure that you get your COVID vaccination, and then also your booster shot. And then, as mentioned, we want to make sure that you adopt a healthy lifestyle. So make those changes, give something, change those habits and start new habits. This is a good time to do that. Start walking, stand. I know I was thinking of different ways of how we could increase physical activity. It's not really exercise, it's just increasing that physical activity, maybe standing instead of sitting. When some people sit down and they prepare food, maybe stand up. Maybe stand there for a few minutes. You're watching TV or you're doing some work at the table. Maybe stand for a few minutes. Maybe take a few steps, add a few steps. Park further away from the grocery store and walk in, take a longer walk. Those poor dogs that are tied up in the Pueblo, maybe take them for a walk. Maybe they need to get out. Maybe they've been tied up for a few years. Take them out for a walk. Let them see what you see every day. And for those of you that are smoking, try quitting. And then also limit your alcohol intake. Some of these habits have been established over a few years, and it's easy to say to quit or to limit. It can be hard to change those habits. And then also manage stress, and you can do that by meditating, talking, walking, finding what works for you. And then lastly, as we've mentioned, we want to stop the spread of the COVID virus. So continuing to limit the people you're in contact with. Be careful, wear your mask, wash with soap and water, We talk about how maybe singing happy birthday when you're washing your hands, you don't want to just splash some water on it. You want to make sure you're using soap, and then washing between your fingernails, washing carefully, and then also sanitizing surfaces. Those are some of the ways to stop the spread of COVID. Easier said than done. But this information was to provide you with information going forward. This month is National Cholesterol Awareness Month. So the takeaway message here is you have abnormally high or abnormally low cholesterol levels. Be careful, be cautious, because your chances if you get COVID, you're more likely to do damage, or there's more likely to cause damage to your body. That's the takeaway message here. That's all I have. Hope you have a great day.
Thank you, LaDonna. Does anybody else have anything to add to the conversation or any questions? Anybody that's watching live, you have any questions about what was just presented? Well, if that's not it, Claudia, Victoria, Darylyn, do you guys have anything to add before we disconnect?
No, I don't.
No, I don't have anything.
All right. Well, it's 11:36. Appreciate everybody who joined live and those who are going to watch later on. Like always, you can always put comments in the comment section or questions, and we'll get to them as they come up. But otherwise, it is 11:36, and I'm going to go ahead and disconnect. You guys all have a nice day.